Hey everyone, DJ Williams here again with Dr. Clifton at MD Hair Labs, and we are going to talk about a treatment that is pretty popular in the athletic world. So when I got hurt playing football, I had a muscle strain, and they said, hey, we're going to do something called PRP. It's called Platelet Rich Plasma, and it really helps regenerate your muscles so you can get back from a hamstring where it may take 6 weeks, may cut that hill down time to 3 weeks.
Absolutely.
Then I heard you're going to start putting this in your head.
So yeah, it's really crazy. PRP has really taken off in the last several years. You can use it for multiple applications. Like you said, really good for muscle injuries. It's amazing for joint damage. You know, I have some arthritis starting, sadly to say, and I've used some PRP for that, and it really does work very well. But it is exciting what it can do for hair. You really just draw your own blood, you spin it down to get the platelet-rich portion, and then you inject it into the scalp. And those platelet-rich proteins help stimulate the scalp and the hair to start really turning on and regrowing.
I know a lot of people out there thinking options, it's great. Then you have those other people thinking, okay, that sounded like you said, draw your blood, inject. You're going to be using a needle. What's the process like?
So the process is you do come in and we draw your blood. We're very, very good at it.
Yes.
My staff is the best.
They are. They've done it with me. I was like, oh my goodness, it's already done.
Not bad, ever bad. And then once we get that blood, we just spin it down. Then we numb your scalp. So a few little needles. A lot of times we'll give you a little nitrous oxide, make you nice and relaxed, make you not care so much that we're aiming a few little tiny objects that are a little sticky at you. So once we get the scalp numb, then we do a process called microneedling, which is a little device that we run over the skin, and it makes little micro channels in the scalp, and it triggers inflammation so that your body goes, oh, there's something going on that I need to heal or that I need to really pay attention to, and it makes your body send its own natural growth factors into the site to really make the PRP work. And then we put the PRP in with a series of little injections as well.
Now I know everyone's body is different. I noticed after I would do my PRP, there was a little bit of swelling. Yeah, it was a little bit noticeable. So for people, when they need to schedule these appointments, is it best to not have to go directly to something? Or
it really would be best, because you're going to have some numbing. So the front of the forehead might look a little white because the epinephrine and the lidocaine that we use can constrict those little blood vessels, and we want that because we want to keep all of that we're injecting really local. But so there'll be some discoloration. The next day there can be a little swelling. Can be slightly tender, just like a very mild bruise. Nothing that would keep you from, functioning or needing pain medication or anything like that.
Yeah, and you said not needing any medication. Can you talk about side effects? Are there any dangerous ones with this? Or?
So that's the really cool thing about PRP. It's your own serum that we're injecting. So there's no chance for an allergic reaction. Cool. There's no chance for anything crazy like that. There will be a little swelling, like we talked about.
It's okay.
A tiny bit of discomfort, but nothing really major. But PRP is most effective if you do more than one treatment. So we usually recommend one treatment a month for a total of 3. Okay,
and speaking of that, the realm of different things you have to offer, I'm picking up on the theme. Usually the more expensive, the less you have to do it, So where does this kind of fall in that realm?
So actually PRP is one of the least expensive things that we have to offer. And because of the safety factor where it's your own plasma, a lot of people really love that concept.
I like it. So for all you athletes out there that have had PRP in that hamstring or that calf, and then you get a little older and then you start getting some of this, losing your hair loss, you can use that PRP in your scalp.
Absolutely.
Keep this little farm fresh. You know what I mean?
It's a great option, a little fertilizer.
A little I love it. All right, thank you so much. Make sure y'all come see Dr. Clifton here at MD Hair Labs.
Come see us.